My name is Dr. Deepak Mehta. I'm a restorative dentist and endodontist from Bangalore. I am involved in private practice since 21 years in the name of Dental Bloom. I have been using Ceramir Pediatric crowns from 2021. I think now it's almost 2 years. So the problem with current options in pediatric crowns in children is at one end of the spectrum we have the stainless steel crowns which are really ugly and most of the kids' parents would not like to have them. And on the other side of the spectrum we have the zirconia, which are really hard and tough, but not very good on the opposing tooth structure. And the other main problem with these two crowns is secondary caries. So this has always been a dogma for many years for pediatric dentists. Of course, there were stainless steel crowns, there was zirconia crowns. I had the opportunity to use both of them. But at one point of time, initially with stainless steel crowns, I had a lot of backlash from the parents of the kids. So I stopped using them because I knew nickel was a big concern with stainless steel crowns. And at the same time, when I started using zirconia, because there was a lot of hype of it being aesthetic, I found it to be too harsh on kids because it was very hard. These were the two options we had. So at one point of time when I didn't like both of them, I changed myself to a direct composite restoration. But then I started to see a loss of retention of these restorations. And that's when Ceramir Pediatric Crown came as a boon to my patients and my practice. The crowns are really aesthetic, they are durable, they can be manipulated very easily, they can be adjusted. It's easy on the opposing dentition, very easy to use for most of the dentists. It's easy to repair because it's a laser sintered composite. So you just need a composite which is there in your practice, and you can just roughen the crown, you can bond, and then you can place the composite and repair it very easily. Having said that, these crowns don't chip very easily unless and until there is some operative error in terms of occlusion. If it does happen, then it's the most easiest to repair currently in the market. So when we are looking at longevity with Ceramir pediatric crowns, of course, for most of the kids, we are working on deciduous teeth, that's milk tooth. And I'm looking at a longevity of say 5.5 to 6 years, which should suffice. As I said, they are bonded to the tooth, they are composite, they are flexible, easy to repair as well. So repairability gives longevity to Ceramir pediatric crowns.